Did your doctor just hand you another prescription without mentioning it could be slowly erasing your memories? Right now, millions of seniors are taking medications that their physicians assured them were safe, yet peer-reviewed research published in some of the world's most prestigious medical journals reveals a disturbing truth. These commonly prescribed drugs are linked to accelerated brain aging, permanent memory loss, and a dramatically increased risk of dementia. Some of these medications sit in your medicine cabinet right now, and you might be taking several of them at once without realizing the cumulative danger they pose to your cognitive health. Before we go any further, I need to make something absolutely clear. Never, under any circumstances, stop taking your medications without first consulting your healthcare provider. Abruptly discontinuing many of these drugs can lead to serious, even life-threatening complications. What I'm sharing with you today is information that should prompt a conversation with your doctor, not independent action. Your physician can work with you to find safer alternatives or adjust your treatment plan to protect your brain while still managing your other health conditions. Now, let me share something that shocked me when I first discovered it. A groundbreaking study published in JAMA Internal Medicine followed thousands of seniors and found that those taking certain classes of medications experienced brain changes that could be seen on imaging scans. Their brains were literally shrinking, particularly in areas critical for memory and thinking. Even more alarming, when some of these individuals stopped taking these medications, the damage didn't reverse. The brain volume they lost was gone permanently. Think about that for a moment. Medications prescribed to help you with one health problem were simultaneously stealing your cognitive future. And here's the truly frightening part. Most of the seniors in these studies had no idea their medications carried these risks. Their doctors hadn't warned them. They were taking multiple drugs prescribed by different specialists who never coordinated care or considered the combined effect of all these medications on brain health. Let me tell you about something called the anticholinergic cognitive burden score. It sounds complicated, but it's actually quite simple and incredibly important for you to understand. Many medications work by blocking a brain chemical called acetylcholine. This chemical is absolutely essential for memory formation, learning, and clear thinking. When you block acetylcholine, you interfere with your brain's ability to function properly. The anticholinergic cognitive burden score measures how much your medications are blocking this critical brain chemical. Research shows that if your score is 3 or higher, your risk of developing dementia increases by 54%. That's more than half again as likely to lose your memories and cognitive abilities. Here's where it gets even more concerning. Over 20% of seniors are taking multiple anticholinergic medications without even knowing it. You might be taking an antidepressant, a bladder control medication, and an over-the-counter sleep aid, each prescribed or recommended by different doctors or purchased on your own. None of them individually might seem problematic, but together they're creating a perfect storm that's damaging your brain day after day, year after year. Let me walk you through the medications that pose the greatest risk to your cognitive health, starting with the most dangerous combinations and working our way down. I want you to listen carefully because chances are you or someone you love is taking at least one of these medications right now. The most dangerous situation occurs when seniors combine anticholinergic antidepressants with other anticholinergic drugs. We're talking about medications like amitriptyline for depression, oxybutynin for bladder control, and diphenhydramine, which many people know as Benadryl, used for allergies or sleep. When you combine these medications, the cumulative effect on your brain is devastating. Studies show a 54% increased risk of dementia with long-term cumulative use. Brain imaging studies reveal something even more troubling. The brain volume loss that occurs doesn't reverse after you stop taking these medications. The damage appears to be permanent. Your brain actually shrinks, particularly in areas responsible for memory and cognitive function, and that shrinkage doesn't come back. Right behind this dangerous combination are antipsychotic medications, drugs like quetiapine, olanzapine, and risperidone. These are often prescribed for psychiatric conditions, but they're also sometimes given to dementia patients to manage behavioral symptoms, which is deeply ironic given what the research shows. Seniors taking these medications face a 60% increased dementia risk. They also experience cognitive decline 2.5 times faster than those not taking these drugs. If you already have Alzheimer's disease, these medications are associated with higher mortality rates and accelerated brain atrophy, particularly in the frontal lobes where decision-making and personality are centered. These drugs affect multiple neurotransmitter systems in your brain, disrupting not just acetylcholine, but also dopamine and serotonin, creating widespread neurological havoc. Now let's talk about opioid pain medications, drugs like oxycodone, hydrocodone, and morphine. These are frequently prescribed after surgery or for chronic pain conditions. The research on these medications and dementia risk is truly alarming. Long-term opioid use is associated with a 60% increased risk of dementia, with the highest risk occurring in those taking high doses for more than 6 months. But the mechanism behind this risk is what should really concern you. Studies show that opioids reduce the formation of new brain cells in the hippocampus, your brain's memory center, by 50%. They also trigger neuroinflammation by activating cells called microglia, which then release inflammatory chemicals that damage neurons. Brain imaging studies of long-term opioid users show grey matter loss in regions responsible for decision-making, learning, and memory formation. Blood pressure medications present an interesting and complex picture. Not all blood pressure medications affect your brain the same way. This is crucial to understand because high blood pressure itself is a major risk factor for dementia, so you don't want to stop treating your hypertension. However, certain beta blockers, specifically those that cross the blood-brain barrier like propranolol and carvedilol, are associated with significant cognitive decline. Research shows that seniors taking these particular beta blockers experienced a 3.2 decline on cognitive tests over 3 years, which is substantial. The good news is that other blood pressure medications, particularly ACE inhibitors, may actually reduce dementia risk by 35%. This means you need to have a specific conversation with your doctor about which type of blood pressure medication you're taking and whether a switch to a more brain-friendly option would be appropriate for your situation. Tricyclic antidepressants like amitriptyline, nortriptyline, and doxepin represent an older class of antidepressants that are still prescribed, sometimes for depression but also for chronic pain and other conditions. These medications have particularly strong anticholinergic properties, meaning they powerfully block that essential memory chemical, acetylcholine. Long-term use is linked to accelerated cognitive decline, and brain imaging studies reveal an 8.3% shrinkage in the temporal lobe, a critical region for memory processing. PET scans show reduced glucose metabolism in brain regions affected early in Alzheimer's disease, suggesting these medications may be accelerating the exact pathological processes that lead to dementia. Benzodiazepines are medications prescribed for anxiety and insomnia, drugs like lorazepam, diazepam, and alprazolam. The research on these medications is particularly concerning because they're so widely prescribed and because many people take them for extended periods without realizing the cumulative risk. Studies show that dementia risk increases with duration of use, ranging from 32% increased risk with 3 to 6 months of use up to 84% increased risk with more than 6 months of use. Think about that. If you've been taking a benzodiazepine for sleep or anxiety for years, you may have nearly doubled your risk of developing dementia. The mechanisms behind this are multifaceted. These drugs impair neuroplasticity, your brain's ability to form new connections and adapt. They also alter the structure of dendritic spines, the tiny protrusions on neurons where communication between brain cells occurs. Anticholinergic medications for overactive bladder, drugs like oxybutynin, tolterodine, and solifenacin are taken by approximately 30% of seniors. These medications work by blocking acetylcholine receptors in the bladder to reduce urgency and frequency, but they also block acetylcholine receptors in your brain. After 3 or more years of use, research shows a 54% higher risk of dementia and measurable grey matter shrinkage visible on brain scans. Some studies suggest that the cognitive impairment caused by these medications may be only partially reversible even after discontinuation. This means that the years you spent managing your bladder symptoms may have caused permanent changes to your brain structure and function. proton pump inhibitors, or PPIs, are among the most commonly prescribed medications in the world. You know them as omeprazole, lansoprazole, and esomeprazole, used to treat acid reflux and heartburn. Millions of seniors take these medications daily, often for years or even decades. Research published in multiple peer-reviewed journals shows a 44% increased risk of dementia in seniors over 75 who use these drugs long-term. The mechanisms behind this risk are fascinating and disturbing. First, long-term acid suppression impairs your body's ability to absorb vitamin B12, a nutrient absolutely essential for nerve health. Without adequate B12, your nerves, including those in your brain, begin to deteriorate. Some research suggests that PPIs increase the formation of amyloid plaques, the toxic protein deposits that are a hallmark of Alzheimer's disease. Finally, let's talk about first-generation antihistamines. Over-the-counter medications like diphenhydramine and chlorpheniramine that many people use for allergies or as sleep aids. These are available without a prescription, which leads many people to assume they're completely safe. They're not. These medications block acetylcholine receptors throughout your body, including in your brain. Research shows substantial brain volume reduction, particularly in the hippocampus, your memory center. Users of these medications perform worse on cognitive tests, with their performance equivalent to someone 2 to 3 years older. The effect is dose-dependent, meaning the more you take and the longer you take it, the worse the impact on your brain. Now, I want you to understand the timeline here because it matters. Some of these effects can occur relatively quickly, while others accumulate over years. Research on benzodiazepines shows that increased dementia risk can begin to appear after just 3 months of use in seniors aged 78 and older. For anticholinergic medications, 3 years of cumulative use is associated with measurable brain shrinkage and that 54% increased dementia risk. For opioids, 6 months or longer of use is when the highest dementia risk appears, along with observable grey matter loss. For PPIs and antihistamines, studies typically look at 7 or more years of use and find significant dementia risk increases and brain volume loss at that point. Tricyclic antidepressants show accelerated cognitive decline and brain imaging changes after 10 or more years of use. And benzodiazepine users show sustained increased risk and neuronal structural changes even 15 years or more into use. Let me explain the mechanisms behind all of this in a way that makes sense. Your brain is an incredibly complex organ that relies on precise chemical signaling to function properly. Acetylcholine is one of the most important neurotransmitters for memory and learning. When medications block acetylcholine receptors, they interfere with your brain's ability to encode new memories and retrieve existing ones. It's like trying to make a phone call when someone has cut some of the wires. The system simply can't function properly. Benzodiazepines reduce neuroplasticity, which is your brain's ability to form new synaptic connections. Your brain is constantly rewiring itself based on your experiences, learning new information, and adapting to new situations. When you take medications that reduce this ability, you're essentially preventing your brain from maintaining and strengthening its neural networks. Over time, this leads to cognitive decline. Multiple studies using MRI and PET scans have documented actual shrinkage in critical brain regions among users of these medications. The hippocampus, temporal lobe, frontal cortex, and overall grey matter all show measurable volume loss. This isn't a subtle effect that requires sophisticated analysis to detect. The shrinkage is significant enough to see clearly on brain imaging. Opioids activate cells in your brain called microglia. When activated, these cells release inflammatory chemicals that damage neurons. This neuroinflammation contributes to cognitive decline and may accelerate the development of dementia. The vitamin B12 deficiency, caused by PPIs, leads to nerve cell deterioration throughout your nervous system, including in your brain. B12 is essential for maintaining the myelin sheath that insulates your nerves and allows them to communicate effectively. Without adequate B12, this protective coating breaks down and neural communication becomes impaired. And finally, PPIs appear to increase levels of amyloid protein, the toxic substance that forms plaques in the brains of Alzheimer's patients. By increasing amyloid levels, these medications may be directly contributing to the pathological process that causes Alzheimer's disease. So what should you do with all this information? First and most importantly, do not stop taking any of your medications without consulting your healthcare provider. I cannot stress this enough. Abruptly stopping many of these medications can be dangerous. Suddenly discontinuing benzodiazepines can cause seizures. Stopping certain antidepressants can cause severe withdrawal symptoms. Discontinuing pain medications without a proper tapering plan can lead to intense pain and withdrawal. Your safety must come first. What you should do is schedule a comprehensive medication review with your healthcare provider. Bring all of your medications to the appointment, including over-the-counter drugs and supplements. Many seniors see multiple specialists, and often no single doctor has a complete picture of everything you're taking. This is your opportunity to create that complete picture. During this appointment, ask your doctor about each medication. What is it for? Is it still necessary? Are there alternatives with fewer cognitive side effects? Could the dose be reduced? For anticholinergic medications, ask specifically about your anticholinergic burden score and what can be done to lower it. For antidepressants, newer classes of medications called SSRIs and SNRIs generally have much lower anticholinergic effects than tricyclic antidepressants. Ask if switching to one of these alternatives would be appropriate for you. For bladder control issues, there are non-anticholinergic options available, as well as behavioral interventions and pelvic floor exercises that can help. Ask about these alternatives. For sleep problems, instead of benzodiazepines or antihistamines, consider discussing cognitive behavioral therapy for insomnia, which research shows is highly effective without any medication risks. There are also some newer sleep medications that may have different risk profiles. For acid reflux, ask whether you still need a PPI or whether you could step down to a less potent medication like an H2 blocker, or manage your symptoms with lifestyle changes and antacids for occasional use. For pain management, discuss a multimodal approach that might include physical therapy, non-opioid pain medications, interventional procedures, or other strategies that could reduce or eliminate your need for opioids. For blood pressure management, if you're on a beta blocker that crosses the blood-brain barrier, ask whether switching to an ACE inhibitor or another class of blood pressure medication would be appropriate given your specific cardiovascular situation. For allergies, newer second-generation antihistamines like cetirizine or loratadine don't cross the blood-brain barrier as readily and have much less impact on cognition compared to first-generation antihistamines. I want you to understand that awareness is your greatest weapon here. Many doctors are not fully aware of the cumulative cognitive risks associated with these medications, particularly when patients are taking multiple drugs from different classes. By bringing this information to your doctor and asking these specific questions, you're advocating for your own brain health in a way that could make a profound difference in your cognitive future. The research I've shared with you today comes from some of the most prestigious medical journals in the world. These are not fringe theories or unproven hypotheses. These are peer-reviewed studies published in JAMA Internal Medicine, BMJ, Neurology, and other top-tier journals. The medical community is increasingly recognizing the importance of considering cognitive risk when prescribing medications to seniors, but this awareness hasn't yet translated into universal changes in prescribing practices. That's why you need to be proactive. Think about what's at stake here. Your memories, your personality, your independence, your ability to recognize your loved ones and enjoy your remaining years. These are not things you want to sacrifice for the sake of convenience or because no one bothered to tell you about safer alternatives. Dementia isn't just about forgetting where you put your keys, it's about losing yourself, becoming unable to care for your basic needs, placing an enormous burden on your family, and ultimately losing years of quality life. The good news in all of this is that you have agency. You have the power to initiate conversations with your healthcare providers. You have the right to ask questions, to request medication reviews, to explore alternatives. Medicine is not something that happens to you. It's a collaborative process between you and your healthcare team. and you are a full and equal partner in that process. Some of you watching this might feel overwhelmed or frightened by what you've learned. That's understandable, but I want you to channel that fear into action. Print out a list of your medications. Write down the questions you want to ask your doctor. Make that appointment. Start that conversation. Even if your doctor can't immediately switch all of your medications, the awareness you bring to the table will change how your healthcare is managed going forward. Every medication decision from this point on can take cognitive health into account. And let me say something to those of you whose loved ones are taking these medications. Share this information with them. Offer to go to their doctor's appointments with them. Help them organize their medications and track what they're taking. Many seniors are managing complex medication regimens, and having an advocate can make a tremendous difference in the quality of care they receive. This issue represents a critical public health challenge. Millions of seniors are taking medications that are silently eroding their cognitive function. The cumulative effect of multiple drugs, each with its own impact on brain chemistry and structure, creates a situation where many people are unknowingly accelerating their path toward dementia. The medical system, with its fragmented care and specialist silos, often fails to recognize and address this cumulative burden. But you now have information that empowers you to be different. You can be the person who asks the hard questions, who insists on considering cognitive risk alongside every other factor in medication decisions. You can be the person who protects not just your heart, your joints, your digestion, and your mood, but also your most precious asset, your mind. Your brain has served you for decades. It holds your memories, your knowledge, your personality. It's what makes you uniquely you. It deserves protection. It deserves to be prioritized in your healthcare decisions. And now you have the knowledge to ensure that happens. So here's what I want you to do. After you finish watching this video, I want you to take immediate action. Get a piece of paper or open a note on your phone. Write down every medication you're currently taking, including over-the-counter drugs and supplements. Next to each one, note whether it appears on the list we discussed today. Then, call your doctor's office and schedule a comprehensive medication review. Tell them specifically that you want to discuss the cognitive effects of your medications and explore alternatives where appropriate. Don't wait. Don't procrastinate. Your brain health is too important to delay. And if you found this information valuable, share this video with your friends and family. The chances are high that someone you care about is taking one or more of these medications without understanding the risks. You could literally change the trajectory of their cognitive health by sharing this knowledge. Subscribe to this channel for more evidence-based health information that can help you make informed decisions about your well-being. Hit that notification bell so you don't miss future videos that could be just as important for protecting your health. Your future self, with memories intact and mind sharp, will thank you for taking action today. Protect your brain. It's the only one you've got.